guys ready to roll? Yeah, I think so. Subcommittee will come to order. We are pleased to have Mr. Cunahan here today, who is the Director and CEO of Marketplace and Exchanges. We're glad to have you here, but we're disappointed that much of the information that the committee's been requesting, primarily through Congressman Meadows' office, has yet to be provided to the committee. So, Mr. Cunahan, you're going to get some questions about that. Beginning on December 8th of last year, Chairman Meadows' staff started requesting detailed information on Obamacare enrollment. The administration's response to this basic data request has been nothing short of ridiculous. We met with Mr. Cunahan on January 9th. He told us repeatedly that he wanted to make sure we got the information we requested. Of course, it's not a surprise that last night the administration came out with another enrollment update. So we hope the witness today answers some basic questions, like how many people were automatically enrolled in their health care plan, how many Americans actively use the health care law, and how many are now passive participants in what the law forces them to do, how many of them were automatically enrolled in another plan, and a host of other questions we hope to get answered. Of those who were automatically enrolled, did CMS place people in new plans if their old plans was no longer available? Who made that decision? How was the new plan chosen? Was any analysis done of whether these new plans had different benefits? Was any analysis done of whether an individual would need to see a different doctor? We're still seeing problems with healthcare.gov. Last week, the administration announced the website had generated 800,000 incorrect information to Americans, and obviously that will impact their tax status. That's nearly 10% of the people who used healthcare.gov received incorrect data and incorrect information. And for the 50,000 people who already filed their taxes, the IRS just said last week, don't worry about it. This is outrageous considering how often the IRS has bemoaned their budget and inability to collect tax dollars. Finally, since the President's immigration announcement, we have learned that illegal immigrants can now potentially obtain tax refunds they're not entitled to, and maybe even potentially participate in our election process. So those are the questions, too, we want to ask Mr. Cunahan today. So we think this is an important hearing. We're pleased to have you here. We're hopeful you'll answer some of the questions that we've been trying to get answers to for now over 3 months. With that, I would yield to the ranking member, the gentleman from Pennsylvania, for an opening statement, and then we'll get right to Mr. Cunahan's testimony.
Thank you, Mr. Chairman, for holding today's hearing. I'd like to welcome our witness today, Mr. Cunahan. I thank you for appearing before our subcommittee. There's good news and bad news about the ACA. I know my colleagues are adept at sharing all the bad news about the ACA, but I want to highlight some of the good news, if I may. The 2015 open enrollment period was a success, with a record 11.4 million Americans selecting Marketplace plans or automatically re-enrolling in quality, affordable coverage as of February 15. In my home state of Pennsylvania, 471,930 people selected a plan or were automatically re-enrolled by the end of the most recent open enrollment period. These strong open enrollment numbers, both across the country and in my home state, show that the ACA seems to be working and continues to benefit millions of Americans. Insurance companies are joining the marketplace in significant numbers, offering greater plan choice to consumers. There are over 25% more insurers participating in the marketplace in 2015 than there were in 2014. 91% of consumers can now choose to purchase plans from 3 or more insurers, up from 74% in 2014. And consumers are able to pick from an average of 40 health plans for 2015 coverage. I also want to say the ACA appears to be helping to reduce premium cost increases in the individual market. In 2015, premiums for the benchmark, or that is the second lowest cost silver plan, will increase by only 2%. Of course, far below the historic trend of double-digit premium increases that we all endured throughout the last 15 years or so. Since ACA open enrollment started in 2013, Medicaid and the Children's Health Insurance Program enrollment has increased by 10.1 million. The ACA has also reduced the number of uninsured people across our country. Because of this law, we have seen the largest decline in the uninsured rate since the early 1970s, and people who care about keeping hospitals open in your communities will want to note that. The lower the rate of uninsured, the healthier our hospitals will be. According to the CBO, the Congressional Budget Office, the combined effect of the ACA coverage expansions has been to extend coverage to 12 million people previously uninsured in 2014. In 2015, CBO estimates that 19 million uninsured Americans will be covered. Thanks to the ACA, millions of young adults, many of whom might have otherwise been uninsured, have been able to stay on their parents' health plan. 129 million Americans with pre-existing conditions can no longer be denied coverage or charged higher premiums. And more than 100 million individuals no longer have an annual or lifetime limit on their coverage, providing the kind of peace of mind that they will not go bankrupt if diagnosed with cancer or some other kind of serious illness. On February 20, CMS announced an additional special enrollment period from March 15, 2015 through April 30, 2015 for taxpayers affected by the individual shared responsibility payment. I am pleased that CMS is taking additional steps to help those individuals who were unaware of the penalty for not having coverage. Now, earlier this month, House Republicans voted for the 56th time to repeal or weaken the ACA, but they have yet to offer concrete legislation that would serve as an alternative to the consumer protections and cost savings reforms that the law has already brought to millions of Americans. The evidence is clear. The ACA is improving the lives of Americans nationwide as a whole, including the constituents of all of the members of this subcommittee who are already receiving important benefits under the law. It's time for us all to stop these constant attacks and focus instead on working together more effectively and efficiently to implement this new American law. I thank the chairman again and look forward to this hearing and our witnesses' testimony.
I thank the gentleman from Pennsylvania. I would just point out that they're not attacks, it's facts. 800,000 people got notices that were inaccurate. People are being automatically re-enrolled in plans that they didn't opt into and may be different from the ones that currently exist. And that's the information we are trying to get at. It'd be nice if we had some cooperation from Mr. Cunahan and his folks. Without objection, the chair is authorized to declare a recess at any time. And we will hold open for 5 legislative days the record for any members who would like to submit a written statement. I'm pleased to welcome our witness today, Mr. Kevin Cunahan, who's the Director of Marketplace, Chief Executive Officer of the Center for Consumer Information and Insurance Oversight at the Centers for Medicaid and Medicare Services. Pursuant to all rules, we swear in our witnesses, so if you'd please stand, Mr. Cunahan, raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Let the record show that the witness answered in the affirmative. And with that, you're recognized for 5 minutes. We've got your written statement, so every member has that, Mr. Cunahan, but you got 5 minutes now for an oral statement. And then we'll get right to questions. So the floor is yours. Make sure you got the microphone on and pull it close.
Is that okay? That's better? Okay. Good morning, Chairman Jordan, Ranking Member Cartwright, and members of the committee. It is an honor to appear here today to answer your questions about CMS's continuing efforts to provide affordable, high-quality health care to the Americans we serve. I joined CMS last September as CEO of the health insurance marketplace after 30 years of experience in the healthcare industry. I worked in senior roles at 3 private health insurance companies. I was president of a private health insurance exchange, and most recently was CEO of Access Health Connecticut, the state of Connecticut's health insurance exchange. I'm pleased that the Affordable Care Act is making a real difference in the lives of consumers. Since the open enrollment period began last year, November 15th through February 15th, about 11.4 million Americans selected a plan or were automatically re-enrolled in states using healthcare.gov or through state marketplaces. Yesterday, we provided updated data on plan selections in states using the federal facilitated marketplace, which shows that approximately 8.84 million consumers who selected a plan or who were automatically re-enrolled through the healthcare.gov platform. The number of uninsured in the United States fell by an estimated 10 million since the start of open enrollment in 2013. The nation's uninsured rate is now at or near the lowest level recorded in 5 decades of data. CMS is constantly working to increase value to consumers by providing more affordable choices and improving the customer experience. We added 25% more issuers participating in the marketplace in 2015, providing consumers with an average of 40 health plans to choose from, up from 30 last year. About 8 in 10 consumers in the 37 states using healthcare.gov received, on average, a $268 monthly tax credit. Over the last several years, CMS has been working with the IRS to plan for tax season and to provide outreach and education on the new tax filing requirements to individuals and tax filing preparers. About 3/4 of tax filers simply need to check a box to show they had health coverage for all of 2014. The remaining taxpayers will need to take different steps, like claiming an exemption if they could not afford insurance, or paying a fee if they could, but chose not to get covered. Those with marketplace coverage are receiving new forms in the mail from the marketplace, Form 1095A, used to reconcile their upfront financial assistance. This is the first time Americans will be working through this new process, and we're prepared for the inevitable challenges. While the vast majority of consumers received correct 1095A forms, some received a form that contained an incorrect calculation. This affects less than 1% of all tax filers and is being fixed so that beginning next week, those consumers can access a new tax form. We conducted a robust outreach effort to give consumers information needed. The administration is committed to providing the information and tools tax filers need to understand the new requirements. Individuals who cannot afford coverage or who meet other conditions may receive an exemption from the shared responsibility payment. We recently launched a tool on healthcare.gov to help consumers who did not have insurance last year determine if they qualified for an exemption. This tool will help consumers determine which exemptions they may be eligible for and how to apply for exemptions, whether through the marketplace or through their tax return. CMS is also providing a special enrollment period in states which use the federally facilitated marketplace for individuals and families who did not have health coverage in 2014 and are subject to the fee when they file their 2014 taxes. The special enrollment period from March 15th to April 30th will allow individuals and families to buy coverage through the marketplace. As I mentioned, having been involved in both the state exchange and private exchanges prior to coming to Washington, I've seen how powerful the private sector companies can be in competing for consumers' business. I've learned from my experiences that communication and collaboration is key. If anyone has suggestions on how to improve our systems and our programs, I would appreciate hearing from you personally, and I look forward to working with you. We're proud of what we've accomplished so far and the difference that high-quality, affordable health care coverage is making in the lives of people throughout the country. Thank you for your time, and I look forward to your questions.
Thank you. Gentleman from North Carolina, Mr. Meadows, is recognized for 5 minutes.
Thank you, Mr. Chairman. Thank you for your opening statement. You're gifted with your words. I guess my concern, and you know that I have a concern, and I'm going to share this with the ranking member, Mr. Cartwright, because even though we're on different sides of the aisle, we believe that this should not be political. And indeed, I met with you personally, told you I didn't want it to be political. I wanted to get the information. So I guess my question is why do we still not have the information we've requested after 23 emails, 7 phone calls, 1 personal meeting, countless other indirect contacts that we've had, 2 text messages? I've been reaching out for over 70 days, and it's real simple. We haven't gotten the information that you've had. So you've been working through the information, so you have not had the re-enrollment numbers in order to comply. Is that correct?
That's correct. I'll wait till you're done.
No, that's a question. You're under oath, so you have not had the re-enrollment numbers that I've requested multiple times.
What is critical, Congressman, is that the information that we provide you or anyone on this committee be accurate, be verified, be validated, and make sure that it's correct before submitting to you.
So is it your testimony here today that you have not had those numbers until today?
Well,
Or yesterday?
correct. You know, you and I spoke yesterday, and I gave you numbers over the phone, and that's correct. We have numbers, but they're not verified, fully validated, fully vetted, that I would give to you.
Well, why would you not give me numbers as I've requested them 23 times? Why would you not give me numbers? Because then I made a simpler request. I said, just send me the batch information. I had to go through and dig through this and just ask for the batch information that you were giving to other insurance companies. Why did you not give me that?
Congressman, I feel a personal accountability in responding to you. I think you know that. You and I have talked. I am committed to giving you information.
Why do we have to have a hearing in order for me to get a phone call the day before to get partial? It's not even all of the information. I only got a little bit of it. So why would we have to wait that long?
Congressman, as I said, I am very committed to getting the information, but it has to be accurate.
All right, so let me ask you this.
Tested. It has to be one that stands up, because if it's not, that creates a different problem.
All right, so let me ask you a more difficult question then. If indeed you were afraid to give me those numbers because you indeed say you didn't have them and that you were verifying the numbers and that you were concerned that they were not accurate, did you give re-enrollment numbers to anybody else outside of CMS? And be careful because you're under oath.
I understand that. What I'm committing to you, Congressman, is that any information that I give you to a request.
That's not my question.
is
That may be a
verified
good
and
answer to a
validated.
question I didn't ask. Did you provide it to anybody outside of CMS?
I am giving you information, Congressman, that's verified and validated. I have enormous respect for you. I understand your goals, and I appreciate what you're trying to do.
So yes or no?
I'm telling you, Congressman, that no information I'm giving to you is not going to be fully vetted.
That's
and
not my
fully
question.
verified.
Are you going to answer the question? Did you give it to anybody outside of CMS?
I'm repeating my answer, Congressman, with deepest respect. I'm giving you information that's, when it's
All
verified
right, well, let me
and fully
finish it.
validated.
I have information that would suggest that you gave it to other people out of CMS. Yes or no? Is that accurate?
Congressman, I'm not familiar with the information that you may have, but
Did you not send re-enrollment numbers? Did you not send re-enrollment numbers to healthcare providers on December 18th? Did you not send that to them?
Congressman, I have to go back and check correspondence from
right.
December 18th. I do not have recollection about that.
Did you give re-enrollment numbers at the White House?
Congressman, I have to go back and check this.
You know what,
I am not,
Mr. Cunahan,
I am not familiar with this.
let me just tell you, and I'll conclude with this statement, I guess. Either CMS intentionally gave misleading information to insurers, insurance companies across the country on December 18th, or you lied to me and said that you didn't have it. Which is it?
Congressman, I have
Either
to,
you intentionally misled them because they got it, or you lied to me. Which is it?
Congressman, I have to check the facts of what you're alleging.
Well, you got counsel behind you. She shows up at every one of these meetings. Ask her to check on it while you're here, and we'd love to hear your answer.
Congressman.
I'll yield back.
Congressman, okay.
Gentleman's time has expired. I now recognize the gentleman from Pennsylvania for 5 minutes, the ranking member.
Thank you, Mr. Chairman. Well, Mr. Conahan, I want to say at the outset that Mr. Meadows and I agree on a great many things here in the United States House of Representatives, and one of them is that we want transparency and accountability in the government. That's why we've put in to serve on this here committee. because this is a committee that is charged with the responsibility of ferreting out problems in the government. And we want to see that, that when somebody on the committee, particularly Mr. Meadows, when he calls you, you call back. Has that been happening? When he calls you, do you call back?
I believe it has been happening. We had a conversation yesterday as a follow-up to a conversation that we've been having since December. I value that Congressman Meadows quite a bit.
And I want to also say for the record, if Mr. Meadows is having a hard time getting a hold of you, I want him to call me and I'll help him get a hold of you.
Will the gentleman yield?
Yeah, I certainly will.
I'll be glad to give you a timeline. We'll share it with you, and I'll let you make your own decision on whether he's been responsive or not. I sent him a text message the last time and said if he's not going to be willing to provide us with the numbers, there's no sense going through that. But, Mr. Cartwright, I trust you, and I will give you the timeline.
Yeah, and I thank you. And reclaiming my time, I think that it would make sense for Mr. Meadows and me to work together to make sure you're being fully transparent and accountable. Mr. Conahan, there was a comment, though, that was made about it took a hearing to be scheduled before you'd make a phone call. And I just want to make it clear, were you subpoenaed to come to today's hearing, or did you come voluntarily of your own will, Mr. Conahan?
Came voluntarily.
All right. Forgive me if I misstate this, but it seems to me that when we're talking about numbers and talking about testimony under oath, as you are you understand you're under oath today, right?
Yes.
And you've understood that very plainly, that when you come to our committee, you're going to be under oath, so we're going to expect exactitude
Yes.
in the numbers that we get from you. Is that one of the concerns that's been driving your reticence about sharing particular numbers, that you want to make sure they are exact and precise when you testify to them under oath?
Yes.
All right. Now, I want to visit this question about the erroneous tax information that was sent out, because that's a concern of mine as well. The agency has sent erroneous tax information to roughly 800,000 tax filers who received coverage through the federally facilitated marketplace in 2014. It's my understanding that these tax filers received erroneous 1095-A forms. Is that correct?
Correct.
And these are the people that you said constituted less than 1% of the filers?
Correct.
Okay. How did it happen?
You know, to the best of our understanding so far, and we're still doing research into this, it appears that there was a unfavorable interaction between two pieces of software code. And upon identifying that, we began our fix.
Okay. So those of us that have employer-sponsored coverage or government coverage, such as Medicare or Medicaid, are not affected by this.
Correct.
And would you take this moment, Mr. Conahan, to explain to us now what the agency is doing to alert tax filers who received the erroneous 1095-A forms about what they need to do to proceed with filing their tax returns?
We're doing quite a bit. We take the issue of the disruption caused by these incorrect forms very, very seriously. And it wouldn't matter whether it were one tax filer or 820,000. We jumped on this issue very fast to uncover it. We have created new tools on our website, healthcare.gov, that help people both understand whether they were impacted by it, how to calculate the correct benchmark plan, that second lowest cost silver. We have trained our call center representatives to take calls from recipients so that they can get the answers that they need. We've made robocalls out, we've sent letters, we've sent emails, we've had a broad-based communication
All right, well,
effort.
Mr. Conahan, I want to express, before I yield my time, I am disappointed that the agency made this kind of mistake at such a critical time. This is an unforced error that provides fodder for those who want to tear down the ACA. but I want to remind my colleagues that it doesn't detract from the fact that millions of Americans now do have access to life-saving health care coverage that they did not previously have. With that, I yield back, Mr. Chairman.
Thank the gentleman, and we now recognize the gentleman from Tennessee, Dr. Desjardins.
Thank you, Mr. Chairman. Good morning, Mr. Coonahan.
Good morning.
It's good to have somebody here that is concerned about exact and precise numbers, because we've had a lot of trouble getting accurate numbers when it comes to the Affordable Health Care Act. And you gave a pretty resounding, rosy testimony in terms of how the health care law is working, but it doesn't seem to coincide with a lot of the people that I hear from, so I was hoping you can help clear up some numbers. You'd indicated that the uninsured rate is at the lowest point in the history of, or recorded history of the country. Is that correct?
I said that the uninsured level has dropped significantly.
And I think you followed with saying that it was the lowest that has been recorded. And I was wondering how you came to that number.
Just to be precise, sir, what I said was the uninsured rate is now at or near the lowest level recorded across 5 decades of data.
Okay, so pretty good. Well, how did you get that data? Where did it come from? How many people are insured in this country? What do we have, 310, 330 million
About
people?
330 million people. To be frank with you, sir, I would need to get back to you with that.
Okay, well, how many people were uninsured when this law first came into effect, when they were selling it to the American people?
Sir, I need to do the same.
Well, I mean, roughly. You don't have to be precise. If the president was throwing out numbers, 30 million, 40 million were uninsured.
You know, sir, I'm not trying to be difficult. I really want to make sure that
Did you prepare at all for this hearing?
Yes,
I listened to your answers to Mr. Meadows, and it just astounds me that you can't remember whether or not you gave information to CMS or to the White House. I mean, you really, that's your testimony, that you just don't remember?
No, it's not. What I simply want to say is that you've asked me a question that has to do with data. I respect that question. I'd like to respond with a precise answer.
Okay. If people don't sign up for the health care law, they're going to pay a tax penalty here soon, right?
Only if they do not qualify for an exemption.
So it's kind of hard to get the number of uninsured till we see how many people have to pay a penalty, because, you know, we've heard that the president said 30 or 40 million people were uninsured in this country. Now you're saying 10 or 11 million have insurance, and we have 330 million people, but yet is it your testimony that about 90% of the people who have signed up are getting subsidies?
What I would say based on our enrollment is roughly 87% of people that enroll in the marketplace.
Okay, so
get
roughly
subsidies.
9 out of 10 are getting subsidies. Yeah. And we have 330 million people. You can't tell me how many had insurance and how many don't have insurance, but you're saying we have the lowest insurance rate, so you're not really helping me with your exact and precise numbers. But what we're seeing is people paying about $2,000 to $4,000 more for premiums, paying much higher deductibles, and yet the president promised most people's premiums would drop $2,500. So, I mean, it's clear at this point we were sold a bill of goods. Do you agree with that?
With deep respect, I do not agree with that, and the reason I don't is because I've been doing this between states and now here in this job for almost 9 years, and I've seen the impact of people getting access to coverage that's more affordable for them.
Well, you and I are talking to a different group of people, but let's move on. Let's talk about some more exact and precise numbers. This month, HHS announced that you will terminate coverage for individuals who signed up in 2014 who have been unable to verify their citizen status. So that's about 200,000 individuals, right?
It appears that that number is going to be less than that.
Okay, we've got numbers that show up to 312,000 individuals should not be receiving coverage. So that's not correct?
Congressman, I would appreciate the opportunity to come back with you with precise numbers on all these questions. So
it sounds like you're going to have to come back, because you're certainly not ready today. How are we going to get that? Well, first of all, how do these people sign up? What data do they need? Do they need a driver's license, a Social Security card? How can they sign up for health care if they're getting it illegally?
So an individual attests on their application to specific amounts of parts of information. We check that information against electronic data sources to verify its validity. There can be situations where that data is going to match. There'll be situations where that data does not match. When the data does not match the verified sources, the trusted sources, it's up to that individual to provide the evidence that supports that they are legally eligible.
So how do we
for
get
coverage.
this money back? And let me ask a second question. With the President's executive order with 4 to 5 million new people gaining access to Social Security cards and driver's license, probably the very information that it takes to get this health care coverage, how are you going to prevent that, and how are you going to get that money back?
Well, Congressman, I think the point is that we take self-attestations, we verify them against proper data sources to make sure that they're accurate. If they don't, or they're not verified, the applicant is required to provide proof that, in fact, that is true. If the proof is provided, they may maintain their coverage. If the proof is not, and the appropriate subsidies and such, and the proof is not provided.
Bottom line is
we
this law
take
wasn't
other
ready, and
options.
it's never going to be ready. I yield back.
I thank the gentleman. We now recognize the ranking member, the gentleman from Maryland, Mr. Cummings, for 5 minutes.
Thank you very much. Mr. Conahan, we're very pleased to have you here. Despite strong evidence to the contrary, Republicans continue to claim that the Affordable Care Act is causing an increase in health care costs. However, multiple reports show that the growth of health care spending in the United States, in fact, slowing to historically low levels. Thanks to the Affordable Care Act, we have seen the lowest growth and the slowest growth in health care prices in nearly 50 years. And the Congressional Budget Office estimates show that the ACA will reduce the deficit by about $100 billion over its first 10 years, and a total of $1.7 trillion over its first 2 decades. And that does not even, when we look at the benefits of it, of course, there are a lot of people who are staying well because they now have access to insurance and therefore medical care. There are people who had pre-existing conditions that are now able to get treatment. And so there are a lot of benefits to this very important law. In December 2014, Mr. Conahan, the Centers for Medicare and Medicaid Services issued its National Health Expenditures Report. Are you familiar with that report, sir?
I've heard of it. I'm not familiar with the details of it.
Well, maybe some of this will be familiar to you. The report found that national health spending grew by just 3.6% in 2013, the lowest rate of growth since 1960. This is down from 4.1% growth in 2012. In your opinion, what factors are driving these low rates? The low rate of growth, that is.
Congressman, I would have to understand the report better before I responded.
Okay, are the Affordable Care Act's payment and delivery reforms, you think that has been part of the explanation? I know you got to get back to me, but do you think that would be a part of it?
I do.
I want to go back to some questions that were asked of you earlier about certain data that you were questioning about whether you had released that data to the White House, and then I think you also asked about insurance companies. Do you all, and it sounds like you wanted to make sure, as far as the committee is concerned, that it was data was properly vetted. And I agree with the ranking member and chairman of the subcommittee that we do have to get accurate information. I guess as I listened to you, I just had one question. If information were released to others, is it done with a caveat? I mean, or how does that work? And I know you said you need to get back to us, but I'm just trying to figure out. I can understand definitely not you making sure you deliver very accurate and up-to-date information to this committee, because man, if you don't, next thing you know, you got big problems. But the question becomes: are there circumstances where information is released to others? Where is there a caveat if that happens, or does it happen?
Sir, I have to look at the information that was provided that Congressman Meadows referred to this December 18th. I'm not familiar with that report.
Okay, so I mean, I'm talking about just general information. In your experience, do you ever release information with a caveat that this is not accurate? It has to be vetted? I think that's a pretty reasonable question.
It is a reasonable question, and the answer to that question is that, you know, depending on the circumstance involved, there may be internal information that's shared, but at all times, when we would ever release information to you, to Congressman Meadows, to this committee, we would not do anything without having that information checked, triple-checked, fully verified.
But so, again, do you ever release raw data without vetting, I mean, to anybody else? I mean, does that happen?
We have released on a weekly basis a snapshot report of how we do in our open enrollment period.
Okay.
I assume this committee's received that.
Okay. And so that data is not vetted, is that right?
No, that data is vetted.
All right. I see my time is expired.
Housekeeping matter here. We have a new member of the full committee, Ms. Lujan Grisham from New Mexico. We ask, even though she's not on the subcommittee, that she be permitted to participate today fully in this subcommittee without objection. At this point, recognize for 5 minutes the gentleman from Georgia, Mr. Heiss.
Thank you, Mr. Chairman. Mr. Coonahan, does your office obtain any supplemental funding from other areas within HHS or CMS?
Sir, I'm not sure of the answer to that question. I need to respond back to you on that.
So you're not aware if there are any supplemental funds at all? Have you ever made a request for supplemental funding?
Sir, I have to get back to you with answers around supplemental funds.
Do you know if you have ever made a request for supplemental funding?
Sir, I am not, it is not coming to mind that I've made a request for supplemental funds, but I don't want to say anything that may not be true, so I please need to get back to you.
Sir, we are providing you with information that HHS provided us regarding transfers that were made last year, some $109 million that was transferred into program management to ensure that the CMS had operations of the marketplace to support what they are doing. Are you aware that this money was transferred to help marketplace operations?
Sir, I arrived in September of last year. I don't know the date or timing of when those requests or allocations may have been made.
Sir, I understand that, but you are the
My suspicion is
CEO.
before my time.
Okay, this is your area of responsibility. So you're not aware at all of where $109 million supplemental funding came from?
I am not aware of that specific supplemental fund that you've just referred to.
Well, let me ask you this way. Do you believe that it's appropriate for healthcare.gov to receive money from the CDC?
Sir, I need to...
Well, it's there in
think
front
about
of
that
you,
question.
provided by your own staff to us that took place. Do you believe it's appropriate for money to come from NIH for healthcare.gov?
The issue of supplemental funds, Congressman, is unfamiliar to me, and I would need to respond back to you upon
Well,
getting
sir,
more
would you
facts.
believe that it should not be a strange subject to you, seeing that this is the area that you're responsible for?
I accept full responsibility for my offices and for the exchange. I'm just unfamiliar with this issue of supplemental funding that you're referring to.
All right, sir. Are you familiar with Form 8962?
With that tax form?
The tax form, yes, sir.
I am.
Okay. CBS News referred to this as a mind-boggling form. Were you in any way responsible or helpful, if we can put it that way, to the IRS for this form and the information that's on it?
The creation of IRS forms is not in my bailiwick.
But according to your testimony, you worked closely with the IRS to provide information they needed to develop some of these forms. Is that correct?
Our offices are collaborative with a number of federal agencies. We were not, to my knowledge, involved in the design of Form 8962.
Well, sir, you are familiar with the form, though?
Yes, I am.
The premium tax credit
Yes, I
form. Do you have a copy of it there?
Yes, I do.
Okay. Just a simple observation of this thing. This 2 pages, over 90 questions just on 1 page alone looking at this, sir. Let me ask you, just looking at that form, is this something that you believe as a CEO here that you could fill out yourself without some assistance?
This form, Congressman, is not a form that my office created. It's an IRS form. I know that there are directions for the form. We provide tools on healthcare.gov to also assist in the completion and the use of the benchmark plan information that's used to complete that form. The 1095A form provides the information needed to complete that.
So you're saying you have nothing to do with this form. It certainly is not a simple form for an American to fill out, but it's necessary if they had any break during the year.
As I said, Congressman, not involved in creating IRS or Treasury forms.
Okay. The Associated Press said that consumer information has been shared with other companies. As people put in information with healthcare.gov, that information has been shared with other companies. Are you aware of that information being shared?
We have shared no names, addresses, Social Security numbers, any personal information with any third parties.
You have not?
We have not.
Okay, well, the report is otherwise. Or is it appropriate for information to be shared?
I'll confirm, we have not shared any names, addresses, Social Security numbers, or any personal information. We will not do so. We have not done so, and we will not do so.
I yield. Thank you.
Gentleman's time has expired. We now recognize the gentlewoman from New Mexico, Ms. Lujan Grisham, for 5 minutes.
Thank you, Mr. Chairman. In New Mexico, where we have some of the most challenging uninsured and access issues in the country, the number of individuals uninsured has dropped by about 25%, and it's one of the largest drops of any state in the country, and it's making a powerful difference in making sure that the health status of a poor state is on its way to improving. And we want to continue to build on that progress. Notwithstanding, it concerns me greatly, and I know that you're hearing that from all of my colleagues today, that CMS sent approximately 800,000 inaccurate tax forms to individuals who signed up for coverage. And I also understand that this is a very large, complicated program, and I understand also, as you've restated it today, that the majority of the tax forms that were sent out inaccurate. But we want to make sure that we're also highlighting that tons of information has also gotten out that's been incredibly accurate and has provided the right avenue for folks to sign up for coverage and get the subsidies and related issues that cause them to not only be covered but stay covered. And we've had several hearings, and I'm going to kind of segue now into the focus of my question, on HHS's efforts and CMS's efforts to make sure that we are addressing the security of this information and the processes are sound, and that we've done 1 million, I hope that that's not an exaggeration, probably is, but that we're really sufficiently addressing the cybersecurity issues significantly. So it's clear to me that that's happening. What's not clear to me, given this mistake, is CMS using specifically the same continuous monitoring that HHS is using to test the website? And do you feel that CMS has those tests and those data points to detect your vulnerabilities?
Congresswoman, please, just to make sure that I understand, this is an issue related to security and perhaps cybersecurity risks?
Be broad. I use that as an example that we, including the cybersecurity, including privacy, including protection, and making sure that it's fully integrated, and making sure that states integrate one-stop shopping and make sure that their data points are all integrated. We know that HHS has done incredible testing. Is CMS using those same mechanisms to test the accuracy of your data and your websites?
I can speak to the website. I can speak to the area that I oversee. What I would tell you is the following. One is that the security of our website is among our absolute highest priorities. Number two is that we use the same type of tools and protections used in the most secure industries in the private sector. Number 3 is that we conduct continuous monitoring using multi-layer professional security team to mitigate any potential types of risks. And we're fully committed to maintaining the security.
But given this mistake, can you point to specifically the safeguards in place, notwithstanding the mistake, that should have caught this mistake? Because my next question, as you answer, maybe you can do both at the same time, is what are you doing right now to correct this problem so that we don't have future mistakes of this nature in this regard or any other regard? And I recognize that no system is foolproof, but what I do expect is that there is this continuous monitoring, you identify the problem, and that you can assure this committee that it's addressed.
Yes, I appreciate the question. Number 1 is I think I outlined the issue with respect to the interaction between these two pieces of software code. We are still digging deeper to understand the root cause, but we believe we've got a fairly good sense of how it's going. I think what's critical, to your point, Congresswoman, is that we have a structure and a process in place that once an issue is identified, that we can understand it, remediate it, fix it, develop a customer support focus to aid customers, and then have a broad outreach program to show customers how to react.
And I appreciate your answer very much, and I realize that I'm interrupting you. I've only got 20 seconds left. I'm gonna ask that you be much more specific, and I'm gonna ask that you do that in writing and provide those specifics if you've been asked by my colleagues to get data back to this committee, so it's clear to us what that means in very concrete, substantive context, so that we can support you to assure that you have the tools and resources to prevent these mistakes and to mitigate. With that, Mr. Chairman, I yield back my time.
I thank the gentlelady, and I will now recognize the gentleman from North Carolina, Mr. Walker, for his 5 minutes.
Thank you, Mr. Chairman. Mr. Callahan, thank you for coming out today. This hearing is morphing into less about enrollment numbers than it is about transparency. You talked about the pre-September, maybe not responsible for all the things that happened there, so let's talk about post-September, if we could, for just a few minutes. In fact, this week, H&R Block announced that 52% who enrolled in insurance via the state or the federal marketplaces are paying back a portion of their advanced premium tax credit. We have the world's largest tax preparer that for more than half of the enrollees, Obamacare is costing more than they were told at first. My question is how do you account for this mishap?
Congressman, our enrollment process relies on eligibility and income information provided by an applicant. That eligibility information and income information is then validated with the appropriate sources to make sure that it's true. As we all know, income can sometimes fluctuate.
So this was the enrollee's fault, had nothing to do with your department?
I'm saying that income can fluctuate. If the enrollment information eligibility information is not updated, sometimes an individual may be getting more tax credits or less tax credits than they would want.
Right. Do you know what the average tax credit is, return?
It's $268 a month.
And the H&R Block reported the average payback is $530. Would you say that's significant?
We, again, sir, I think that having to pay back anything is significant. The 268 translates to roughly $3,200 a year. Again, I think that with 87% of our enrollment receiving tax credits, it's made a profound difference in providing an accessible, affordable care.
Thank you. We've hit already 8 to 10 different specific areas. Let me talk about a number that you might be able to provide. On a scale of 1 to 10, how would you rate the department's handling of these issues that we're talking about today?
I feel extremely proud and comfortable representing the way that we've handled our issues.
8, 9?
And the reason,
very good.
And the reason why is because we've created a process that identifies a problem, looks at root cause, fixes, provides customer support and outreach. And I say that because it's a repeatable process, and it's the appropriate way to respond.
Sure. You spoke earlier about you're unable to give numbers out until they're fully vetted. I believe you used the word verifying.
Yes.
Can you speak for a few seconds? What is your vetting and verifying process?
So we have a data analytics team that's dedicated to reviewing our data. they're in charge and accountable for, assuring that it's right, that it's tested, that it's appropriately validated and vetted, and they're accountable for that.
Do they, once it's vetted, do they give those numbers to you, Mr. Callahan?
When the numbers are appropriately tested, verified, and validated, yes.
And who provides those numbers to you?
The Data Analytics Department.
And those numbers, since September, have you given those out to more than 5 or less than 5?
I'm sorry, when you say 5,
As far as these numbers that have been released, people that you've shared these numbers with, even though they're not complete, is it more than 5 groups, agencies, individuals, or less than 5?
well, as I said, it's critical for us that we don't share any numbers that haven't gone through this process. And what I've tried to communicate this morning is the urgency and the priority we place on making sure that the numbers that we give are accurate.
So up until today, there have been no numbers shared pre-vetting or post-vetting until now.
The example that I would use, Congressman, is the weekly snapshots that we provide. There are an update of our open enrollment progress, is a good example of how that information gets verified and validated before it's released.
Thank you, Mr. Chairman. I yield back.
Thank the gentleman. Now recognize the gentleman from California, Mr. Desaulniers, for 5 minutes.
Thank you, Mr. Chairman. Great job on the pronunciation.
Did I get that right?
Yeah. Well, thank you for being here today, and I must admit, Mr. Chairman, it's, as a freshman from California, it's taking some use to getting, to assimilating some of the comments from other parts of the country. While we've had challenges in California, generally it's been positive, and in my previous life, I chaired the Budget Subcommittee for Health and Human Services, and worked closely with our members of our exchange, both Republicans and Democrats. So having said that, as a supporter of the ACA and believing that we have to recognize the size of the challenge that you're trying to implement it, but also being consistent with all the concerns by members on both sides, as a supporter, I want as few criticisms as possible within the range of this is huge domestic policy that's very complicated. So sort of to the last comments, within that context, without quantifying it, and in the spirit of, I would really like to not see these kind of things happen and not have to defend them because I don't think they're acceptable. Where do you feel as if you've done enough corrective actions on the macro level so that we don't see these kinds of things in the media and give the critics the opportunity to take on the whole program altogether?
The process of implementing the law requires significant amount of testing. And an example of that type of testing, whether it's stress testing, load testing, performance testing, and such, was the relaunching of our website this year. I think that it's probably well known that we had a few bumps or glitches in the first year of its rollout. In its second year, we went out of our way to be very conscious about improving the customer experience. We reduced the number of enrollment screens from 76 down to 16. We put new decision support tools in place that allowed people to select plan either by issuer, by deductible, by even being conscious of a healthcare condition, by premium. We have a whole section, the Learn section of our website, that provides additional decision support tools to help people pick a plan. We offer 25% more issuers than we did the year before, which is providing more competition. We believe in the marketplace. We believe in competition. We've seen, in fact, that it has driven the adding of more value to consumers that came back and shopped and compare. So all of what you've described is required as part of a testing process. Is testing always perfect? No. Can there be these instances which occurred here where you have this two pieces of code that interact unfavorably? Yes. The question, I think the point from our perspective is, what do you do about it? Mm-hmm. And from our perspective, we've put in a repeatable process of identification, remediation, tools, and communication.
So I believe in cost benefits when they're done right. So you've got the cost benefits sort of on the political side and the fiduciary side. we've talked a lot about the costs in this context. The benefits I want to talk about for a minute. So according to the CBO, the ACA reduced the number of uninsured Americans by 12 million in 2014 and would bring down the uninsured rate by 19 million in 2015. CBO has also found that between 2016 and 25, the ACA would reduce the number of uninsured by between 24 to 27 million Americans. Can you explain the impact reductions on the uninsured rate have on uncompensated care costs and the price of premiums?
It's had, to the states that I've worked in particular, it's had significant results in impacting and lowering those costs.
Thanks. If you could give me, if you have any for the future, both on the testing and more specific, I know it's on a broad range of numbers that you could give me after the hearing at some point, that would be helpful. Since the ACA open enrollment started in 2013, an additional 10.1 million Americans have been newly enrolled in Medicaid. In the Children's Health Insurance Program, CHIP, to date, 22 states have decided not to expand Medicaid to their residents. The question is, if all 50 states expanded Medicaid, do you have an estimate of approximately how many more low-income Americans would gain access to affordable health care?
Congressman, I don't have a significant estimate enough that I'd be confident enough sharing. I do know that, again, based on my experience, it would have a dramatic impact.
Appreciate it. I yield back the remainder of my time, Mr. Chairman.
Thank the gentleman. Now recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Mr. Chairman. Mr. Cunahan, thank you for being here. You testified earlier that, that you came here voluntarily. How long have you known that you were going to be coming here?
I think a couple of weeks, but I'm not
A couple of weeks?
sure.
Was for someone who knew for a couple of weeks they're going to be coming here, I hear a lot of answers of, I don't know, I'll have to get back to you. So I'm not sure about the preparation for it, but I do appreciate you being here. I want to ask you, 800,000 incorrect forms. Is that acceptable?
Congressman, having one incorrect form is not acceptable. But
Well, there's a big difference between having one and having over 800,000.
I understand that. But I think the point is what do you do about it? And what I tried to communicate is the process put in place to identify, remediate, communicate, and move on.
Okay, well, what have you done? I mean, well, first of all, let's back up. What happened? What was the typical error? What?
As I mentioned earlier, the best of our understanding right now is there were two pieces of software code that interacted in what's called unfavorably. So it ended up taking replacing the 2014 benchmark price and putting in the 2015 benchmark price on those forms for the 820,000. It didn't happen, obviously, for all of them, and it was a minority of the forms. But that's our best understanding.
Okay, and when are you going to get it corrected? You know, my daddy used to tell me, he used to say, son, that's why they put erasers on pencils. Well, you know, I hope y'all have invested in an eraser factory because you're going to need a whole bunch. When are you going to get them corrected? I mean, I don't know about you, but April 15th, I get knots in my stomach. Man, I'm trying to get all this stuff together for the taxes, and my wife, she's trying, and it's not a good time.
Sir, I can relate to that. I've got the same issue with my wife. The forms will be going out next week.
So you have it corrected by then?
The corrected forms are going out beginning next week.
Well, thank you. I want to shift gears real quick. King versus Burwell, you're aware of that.
I am.
And you know that that's coming up. And I think we've all got our own opinions on what the Supreme Court will rule. I know I think it's pretty clear what they should rule. I think it's pretty obvious that those subsidies were intended for state-run exchanges and not for federally run exchanges. And it's important in my state, in the state of Georgia, because we have a federally run exchange. And if those subsidies go away, what's your plan? What have you got a backup plan?
Secretary Burwell has spoken to this issue consistently. I don't have anything more to say other than what the Secretary has spoken for us.
So you haven't had any input into what you might be able to offer as a backup plan?
As I said, the Secretary has been very clear about our position on this issue, and that's perfectly fine with me. I don't have anything more to add to what the Secretary said.
Do you mind repeating to me what the Secretary said?
She believes that we're on the right side of the issue and that we will prevail.
Okay, so we take the attitude that we're going to win, so we don't need a backup plan.
As I said, the Secretary has been very specific on it, and I don't have anything more that I could contribute to.
Have you spoken to the White House about it at all?
I have not spoken to the White House, but the Secretary has spoken on the issue, and I don't have any more to add.
Goodness gracious, I know that gives the American people a lot of relief to know that. I mean, you know, we all have backup plans. Nevertheless, if that's the case, then I certainly understand. I want to get back to a question that was asked earlier about the sharing of information. Now, it's been reported by a very reputable source, the Associated Press, that information from healthcare.gov has been shared to private companies. You're telling me that is not true?
I am telling you definitively, sir, that that is not true. We have not shared any personal information. We have not shared anything that includes names, addresses, Social Security numbers, any personal information.
Okay, you haven't shared it, but do you know if any's been obtained? Do you know if any's been leaked?
We have not shared any information, sir. Any personal information.
Okay. Mr. Cunahan, again, I thank you for being here. I wish you'd been better prepared, but it is what it is. Thank you. Thank you, Mr. Chairman. I yield back my time.
I thank the gentleman, and I think I'm up, so I'll recognize myself for 5 minutes. Mr. Cunahan, it's nice to meet you. I'm a new member of the committee, so I haven't had a chance to talk with you before.
Nice
I'm Nick
to meet you.
Mulvaney from South Carolina. And what I want to spend most of my time on is just following up on some of the things you've said to some of my colleagues on both sides, starting with Mr. Meadows from North Carolina. He asked you why you had not been able to provide the breakout data that he had sought on the enrollment numbers. And your answer was that you wanted to make sure the numbers were vetted and verified. And I think Mr. Cummings actually asked you similar questions. You said we'll make sure the numbers were checked and double-checked and triple-checked. So let me ask you a couple questions about that. Is that the same standard that you use, sir, before you release information to the public?
Yes.
It's the same standard that you use before you release information to the media?
Yes.
All right, so the information that came out a couple weeks ago that said that somebody had miscounted folks who had enrolled in dental coverage, did that come out of your office?
As I recall that issue, that was an issue related to enrollment of last year.
Right.
Where standalone dental membership was included with the health care.
Correct.
Yeah.
And did that data come from your office?
Yes, it did.
Had that been vetted, verified, checked, double-checked, and triple-checked before it was released to the press?
Our commitment in communicating data,
Hasn't
Mr. Vice
changed.
Chair,
Yeah, I got you. Okay.
is to make sure that it is verified.
Fair enough. And it wasn't in that particular circumstance, was it? It was wrong.
Mr. Chairman?
And there's nothing wrong
Vice
with admitting you're wrong, Mr. Cunahan. I've been wrong. I mean, it's only 11 o'clock, and I've been wrong 3 or 4 times today. The data that came out on the enrollment data was wrong, wasn't it?
Sir, what I would like to communicate to you and to the committee is not only our commitment to verification.
I get it.
But,
That's fine. Mr.
But
Cunahan,
that
I
we
promise not to beat up on
okay,
you if you
but-
promise not to filibuster the time. That's
Okay,
fine.
but we have put in new safeguards to
I know a
avoid
lot of
that
people
type
who
of problem.
listen, I work with politicians. I have a lot of people who admit they're wrong sometimes. Don't worry about it. Let me ask you this: the process. How long does it take to answer Mr. Meadows' question?
Well, Mr. Meadows had several questions.
Okay, let me do it this way. If I ask you the
and-
question, listen, Mr. Cunahan, can you tell me how many people were auto-enrolled in a different program last year? How long should it take you to answer that question?
It's a seemingly simple question. It's a very complex question.
Again, I recognize it might be, and I simply ask you, how long should it take you to be able to get, if the White House called you and asked you for that, how long would it take you to get that number to them on a vetted, verified, check, triple-check basis?
I'm unsure.
Okay. How many people were, let's go a different way at this. How many people were unenrolled or uncovered by insurance, health insurance, before the Affordable Care Act came under law?
That's one of the issues one of your colleagues asked
Yeah.
that I need to follow up on.
The President said it was roughly 30 million people. Was he roughly correct? And he said that, I think, in 2009 in a joint session of Congress.
I suspect he is.
Okay, so roughly 30 million people were uninsured at the outset of the Affordable Care Act, before the Affordable Care Act became law. Fair enough. How many people in the country are uninsured today?
Sir, that also came up from one of your colleagues. It's a good question that I'm coming back to you with an answer.
Okay, can you give me an educated estimate within, say, 1 million people?
Sir, I need to get back to you with a more precise response.
Can you give me an estimate within 5 million people?
I want to get back to you with a precise
How about
response.
10?
I want to get back to you
You
with
don't
a
have
precise
any
response.
idea how many people are uninsured in this nation?
Sir, I've learned with information it's important to be precise.
I get you. Let me ask this. You got a question earlier from, I believe, Mr. Heiss regarding supplemental funds that were available to your organization.
Right.
Who knows whether or not that is a true statement, whether or not you received supplemental funds? You said you don't. You said you weren't familiar with it. Is that correct?
That's correct.
So who in your office would know that answer?
I need to explore that.
Are you aware, Mr. Cunahan, that if you were the CEO of a publicly traded corporation that was subject to the Sarbanes-Oxley requirements, that many of the answers that you're giving today could get you thrown in jail?
Sir, I'm unfamiliar with the Sarbanes-Oxley.
Have you told
provisions.
anybody in your office not to provide you with information?
I have not.
Okay. Has anybody in the White House told you not to seek information regarding any of the information this committee has sought?
No.
Okay. Do you feel like you have faithfully undertaken to collect the information this committee is seeking from you?
I believe I've got a commitment, and it is my responsibility to provide that information. I also believe—
Actually, that may be the most stunning answer you've given, Mr. Cunahan, because that was an easy yes. I asked you if you thought you had faithfully undertaken to give us the information. You should have said yes, and you didn't. My time, however, has expired, so I'm going to recognize now the chairman of the committee for 5 minutes, Mr. Jordan.
I thank the I thank the gentleman. Mr. Cunahan, we're having a little debate here in Congress this week over what I believe is an unconstitutional action the President took last November, and with 5 million folks who are in the country illegally. Will any of the individuals affected by the President's executive action, which I think was unconstitutional, and you don't have to take my word for, lots of legal scholars on both sides of the aisle think was unconstitutional, and a federal judge ruled just last week that it was unlawful. Will any of those individuals affected by the President's order on immigration be eligible for advanced premium tax credits or subsidies to purchase health insurance?
What I know, Mr. Chairman, is that in order to be eligible, one has to be either a citizen of the United States or lawfully present.
So,
as a result, sir, the answer to your question is no.
can you guarantee that the folks who have enrolled through the marketplace, can you guarantee none of them are illegal aliens, illegals affected by the President's, people impacted by the President's executive action?
As I mentioned before, we have a specific process for verifying any self-attestations for enrollment. If someone says that they have a certain type of eligibility information, that gets validated against data sources to see if it's true. If they can't provide that, we require that they provide specific documentation to prove their eligibility. And that's binary. They either can or they can't.
To date, do you know if any non-citizens have actually enrolled in through healthcare.gov and are receiving benefits under the Affordable Care Act?
We've had enrollees that have been unable to provide the documentation necessary to prove their eligibility, and they have been terminated.
Okay. 2 weeks ago in this committee room, a colleague of ours, Mr. Mulvaney, in fact, the gentleman chairing the committee, asked the head of the IRS if illegal non-citizens could, in fact, go back and receive tax benefits through the Earned Income Tax Credit, and the answer was yes, that can happen. We also asked Mr. Koskinen, the head of the IRS, if, in fact, he had been consulted by the White House before the President took his unconstitutional executive actions last November. He indicated that the White House did not talk to them. Has the White House talked to you, the CEO of the marketplace for healthcare.gov and for the Affordable Care? Did the White House consult you before making their decision last November?
No.
Not at all?
No.
Have you been in consultation with them since the decision has taken place to understand it better, or any type of consultation since the decision was made?
No.
Okay. With that, Mr. Chairman, I would like to yield the remainder of my time to the gentleman from North Carolina.
I thank the gentleman from Ohio. I want to follow up on Mr. Mulvaney's question because you say that you vet all the numbers that you give out. So when you put out a press release that said 800,000 people had gotten the wrong information.
820.
Well, you put out 800, but when you said that it was 800,000 and that 50,000 of those had already filed, how did you know that?
Congressman, I'm not sure of the details.
You didn't know that.
I'm not sure of the details of how we
Well, let me tell you how you didn't know that, because you're not with the IRS. So how was that vetted? I mean, you just told Mr. Mulvaney you vet every number that goes out and you only put it out, and yet you couldn't have vetted that number because you didn't have access to the IRS information, do you?
What I meant to say, Congressman, is that we have a data analytics department in my operation, our operation, that is responsible for exactly vetting data that comes out of our office.
So did that information come out of your office? It was your press release. So you only vet the information that you don't want to give to Congress. Is that correct?
No, that is not correct.
So you vet all information,
We vet
except when it's a press release that may look negative towards you. Because you didn't vet that information. Let me tell you how you got that 50,000. It was a guess based on percentages of people that may or may not file returns, and yet you put it out as the fact.
Sir, what I can respond to, and what I can...
Was it not a guess?
When I can speak to you factually, is the protections we put in place to assure that the data that we give you, that I gave you yesterday over the phone, for example, is accurate.
I'll yield back.
The gentleman, the time belongs to the gentleman from Ohio, and his time has expired. We're going to now recognize for a brief second round of questions the ranking member, the gentleman from Pennsylvania, Mr. Cartwright, for an additional 5 minutes.
Thank you, Mr. Chairman. Mr. Conahan, you're appearing before the Oversight and Government Reform Committee, subcommittee on health care, and you know, we are a collection of members of Congress. Some of us voted for the ACA, some of us voted against it, some of us were not here when it came up to be voted on. My own view is that the ACA is the law. We need to try to smooth out the rough parts on it and make it work for Americans, and to amend it where it needs to be amended and make it better. But as much as we disagree about these things, I and the people across the aisle from me, we do not disagree about the function of this committee and of the government employees who come before it. We demand government transparency here in the OGR committee. We demand accurate answers and timely answers. And I want you to commit to follow up with Mr. Meadows and anyone on this committee in an accurate and timely fashion. I understand. I mean, it was brought up before. There was that question of including dental coverage in the numbers of people enrolled. And I think it was something like 400,000 people that got dental insurance were included in the overall numbers. But the bottom line was it was an honest mistake, but it inflated the numbers, so it looked like somebody was trying to paint a rosier picture than actually existed. And it came out of your office. It was wrong. It was pilloried here on this committee as being wrong and in the national press. And I must say, I have to say, it's got to be fair to say that you emerged from that experience much chastened about bandying about numbers that later turned out to be wrong. So I encourage you, Mr. Conahan, be really careful, because as we continue to debate the merits of the ACA, as we continue to decide what needs to be changed about it going forward into the future, the more you make mistakes about numbers, inaccurate numbers, the more you make mistakes about tax forms or whoever made that mistake, whether it was a software error or a human error, the more you damage the debate about the merits of the ACA. And I appreciate your reticence about giving inaccurate numbers today. But I do encourage you to hurry up, get the accurate numbers, and get them to this committee. Do you undertake to do that, Mr. Conahan?
Yes.
Well, I thank you, sir, and I yield back my time.
Thank you, gentleman from Maryland. I'm going to recognize myself for an additional 5 minutes. Mr. Coonan, I'm going to take a different line of questioning now. I'm just going to ask you about some data, that whether or not you do or do track this kind of data. And I'm going to use myself as an example. I am enrolled in the Obamacare exchanges, as are many members of Congress and many of our staff. I had coverage through my employment, as most folks do. Most folks who have coverage get it through their work, prior to enrolling in the Obamacare exchanges. So my question to you, sir, is am I counted in the roughly 10 or 11 million people who have enrolled?
You are enrolled through the Washington, D.C. Link Exchange?
Correct, yes, sir, the D.C. shop, I think.
You would be not part of the federal exchange marketplace numbers. You would be included as part of the state-based marketplace numbers.
But when you say that 11 million people
Yes,
have signed up for
that-
Obamacare, me and my family, we are 5 of those 11 million people.
Yes, as I understand it, you and your family are enrolled through D.C. Link?
Yes, sir.
Which is a state-based
Well, my
exchange?
kids are enrolled through South Carolina. My
Oh.
wife and I enroll separately because they live back home. But
Okay.
generally speaking, we've signed up through the exchanges.
Okay. Well, I don't know if it's just you that's in D.C. Link or the family, but as...
But we're all counted in the 10 to 11
If
million
you-
people who have signed up for Obamacare.
If you and your family are in D.C. Link, you would be counted.
And in South Carolina, the folks are counted as well, aren't they?
The South Carolina people that participate in the federal marketplace, yes.
Yes, okay, that's fine, and that's what we are. So here's my question to you. When you tell Congress, when you tell the public, when you tell the media that between 10 and 11 million people have signed up for Obamacare, do you track differently people who had insurance before and are now on the exchange?
When you say track, could you define that, please?
Do you know how many of the 10, let's use the number 11 million people.
Yeah.
I'll give you the benefit of the doubt today.
Yeah.
Let's say 11 million people have signed up for Obamacare. Do you
Yeah.
know how many of those folks were insured separately before they signed up for Obamacare?
Not consistently.
So you don't know how many of those 11 million people are newly covered.
Well, there are studies that are done by many organizations that track
Not
that.
asking about studies by outside, I'm
But-
asking about you folks. Do you
but-
track that number?
But the number that you are referring to is a combination of two sources. It's a combination of the federal marketplace, and it's a combination of state marketplaces.
Correct.
Some states track that information. Some states do not.
Does the federal exchange?
D.C. Link, as a matter of fact, does track that.
So you know how many people within the federal exchanges have?
I said D.C. Link, which is the Washington, D.C. state-based exchange.
Okay, well, good. We'll look forward to getting that data then.
Okay.
All right, with that, I've got 2.5 minutes left. I'm going to yield the balance of my time then to the gentleman from North Carolina, Mr. Meadows.
So let's go back to the definition of fraud. Would you agree is knowing that you are doing something that is incorrect and not telling anybody? Would you agree with that? Is that fraud? Is that fraudulent?
Sir, I'm not a lawyer.
Oh,
I
okay,
don't-
I'm not a lawyer either. How would you define fraud? Okay, maybe that's too hard of a question. So let me get to an easier question.
Okay.
Are there people in the Affordable Care Act, through no fault of their own, not misrepresenting their income, that are getting the wrong subsidy?
The subsidies are very dependent on information provided by the...
That's not my question. My question is, without their income, assuming everything they told you is 100% accurate,
Right.
are there people in the Affordable Care Act that have done everything right that are getting the wrong subsidy?
If there are people that provided all the correct information, that updated their eligibility in a timely way...
That's not what I ask.
Well, I'm trying to...
I ask a very specific question. They did everything right.
Yeah.
You auto-re-enrolled them.
Yeah.
Are they getting the wrong subsidy?
Okay. I didn't...
You know where I'm going with this?
I understand it clearer now. You're talking about the enrollment for 2015 and the 2014...
The auto-re-enrolled people, are they getting the wrong subsidy?
If they did not come back into the marketplace and update their income and eligibility like we've strongly encouraged
Right.
throughout the summer and throughout the fall, it is possible that they're getting an incorrect subsidy.
Yes or no? Are they getting, you know the answer?
Congressman, with
There's almost 2 million people, according to the numbers you gave me yesterday, that were auto-re-enrolled.
correct.
Are the vast majority of those getting the wrong subsidy?
I don't know the answer to that.
Okay, well, let me answer it for you,
Okay.
because I've had to go do all the work. And I can tell you the answer to that is yes. And you know it's yes. And you're perpetrating a fraud on the American people. Do you not know that they're getting the wrong subsidy?
Sir, with all due respect, I'm not sure that you can say that they're getting the wrong subsidy.
Okay, I know that
And
I know that over 9,000 people in my district that were auto re-enrolled are getting the wrong subsidy because you used the subsidy from last year and the silver benchmark plan that they were on last year changed. So would you agree that 9,000 people in my district are getting the wrong subsidy?
I would not necessarily agree with that because unless you have different information, Congressman, and you very well might, but some of those 9,000 people could well have come back to healthcare.gov, updated their income and eligibility, and be getting the 2015.
I'm talking about passive re-enrollment. Listen, you're splitting hairs. I know this almost as well as you do now. The passive re-enrolled people, are they getting the wrong subsidy, yes or no?
If people did not come back to the marketplace and did not update their eligibility, it is possible that they could be getting the 2014 subsidy, yes.
And you know that. So have you notified those people that it's incorrect?
We notified people, as I understand it, this was before my time, but when this decision was made last summer, so this would be the summer of 2014, there was a broad communication campaign to alert people to this decision.
In January, of the almost 2 million people that you, and it was more than that in January, but assuming that there's 2 million people that were auto re-enrolled.
Yep.
You know, because 820,000 of them just got the wrong 195As, you know approximately how many people are getting the wrong subsidy.
But sir, those are actually independent actions.
I understand that.
Yeah.
Gentleman's time from South Carolina has expired. You have another 5 minutes to the gentleman from North Carolina.
I thank you. So let's follow up on this questioning. Do you have any estimates on how many people are getting the wrong subsidy today?
Sir, I do not.
Have you looked for those?
What I can tell you is the information that I gave you yesterday, for example, showed that 1.96 million people were auto re-enrolled.
No, that's not correct.
What do you mean it's not correct?
Auto re-enrolled was 2.8 something, and then people came back and actually came back, and so then the net number now is that number you just gave me.
That's correct. It was 2.83 as of December 16th, 2014.
Well, December 16th is curious because open enrollment didn't stop and automatic re-enrollment didn't stop until December 18th. So why the 2-day difference?
But that was where we ended auto re-enrollment.
So at December 16th, that was the accurate number.
That is correct. And as a matter of fact, as you may recall over the phone, you and I actually walked through
where the other numbers came from.
That's right.
Right.
That's right.
So,
and I'm sorry, sir, just to insert one other point, is that we continue to strongly encourage people to go back to healthcare.gov.
I would too, because according to my numbers, there are hundreds of thousands of people getting the wrong subsidy, and you know that that's correct, don't you?
Sir, we are encouraging people to go back to healthcare.gov, update
That's not
their eligibility.
That's a
update
statement.
their
That's not an
income.
answer to my question. Do you know that hundreds of thousands of people are getting the wrong subsidy?
Sir, as I'm telling you, we are encouraging people to get the right subsidy by updating their eligibility.
Okay. Is it not fraud when you know that you're doing wrong and not informing the very people that you've been charged to support? Is that not fraudulent?
Sir, I don't know the legal definition of fraud, but what I can tell you is...
Is it ethical?
Is when this decision was made back last summer, that there was broad communication and outreach about the decision. Going into the fall, when I arrived, that has been going on in the same.
So
and it
you support
continues
that
now.
decision? You support the decision to keep the American people in the dark. Most of these are very low-income folks, or at best moderate income, and what they're going to get is a surprise, and you know they're going to get a surprise a year from now where you've given them the wrong subsidy.
The decision was made in the summer of last year. Since that
And you support that decision. Obviously, you haven't changed it.
Since that decision was made, we continue to try to get people to go back and update their income to make sure exactly what you're saying does not occur.
But it is occurring. Wouldn't you agree?
I would agree that it may occur.
You're an intelligent individual. Is it occurring or not?
When people do not update their eligibility, they are going to be having the 2014 APTC, the Advanced Premium Tax Credit, applied. But as I said, sir, this is
In North Carolina, so if that's the case, so let's take your assumption. Out of all the people that auto re-enrolled in North Carolina, if that is the case, over half the counties have a different benchmark plan. So they would be getting a different subsidy because their carrier is no longer the same carrier.
But, sir, I think you're forgetting one critical component, which is you're assuming that nobody's coming back to update their eligibility or income.
No, I'm not.
I don't know.
I started out with that. These are passive re-enrolled people, which means they never came back.
That's correct, sir. But it's still possible for people to come and update their eligibility.
I understand that.
Yeah.
So if they didn't come back,
Yes.
they're getting the wrong subsidy.
They would be getting the 2014 subsidy.
So is it wrong or right?
It's the 2014 subsidy. It's not the 2015 subsidy.
Okay, did the subsidy, and I hate that you're going through this, making me go through all of this. Did the subsidy in most of the counties in North Carolina, and in fact, across the country, according to your press release, change because the silver benchmark plan changed?
Well, you're absolutely right, sir. It depends on the county. It's a county-specific issue. I can't recall offhand how many counties throughout the country where that occurred.
Well, according to your press release, over 85% of the people could have gotten a lower plan. So is that correct? I'm sure you vetted that number.
There are instances where the
Well,
second lowest cost silver.
I'm out of time, so I'll yield back. I thank the patience of the chair.
Thank you, Mr. Meadows. The chair recognizes the gentleman from Tennessee.
Mr. Cunahan, what would you say would be the best way to define success of the Affordable Health Care Act?
That's a very good question. I think it's several things. I think one would be reduction uninsured.
Okay, well, let's talk about that, because I think
I
that's probably how you would define that. I mean, the president's...
I think it's multidimensional.
Okay, but let's start with that, because that's an important topic. That's what the president said. We needed this law because there are 30 million uninsured people in this country, and we need to help those people. So, did you write your opening statement, or did somebody write it for you?
It was written with my input.
Okay, and when you talked about the number of uninsured, you told me it was the lowest in 5 decades.
Yes.
What was the uninsured rate 5 decades ago?
I'm not sure.
Okay, how do you know that it's the lowest if you don't know what that was, and how can you tell us today, tell this committee, that we have the lowest rate of uninsured in 5 decades? When we asked, I think Mr. Mulvaney asked if you could tell us within 1 million or even within 5 million, and you didn't give us an answer. Can you give me an answer now?
What I can tell you, and I'm happy to provide this as part of my statement, is that each of the data that has been cited has a reference point to where that came from.
Okay, well, you're telling us that there's 11.6 million people signed up, so we don't know whether those were previously uninsured or people who just changed insurances.
So that's information that's tracked by some states. There are studies done periodically that do measure the impact on the uninsured, both through Medicaid expansion and through the rollout of qualified health plans.
Do you feel like your opening statement was accurate and truthful?
Yes.
Okay, so your claim that we have the most uninsured can't be substantiated by you today because you can't give us any numbers. So are you just theorizing that that's the truth, or is that the truth?
No, every piece of information in my testimony, my opening statement, was qualified and cited to a specific data source.
Well, we worry a little bit about propaganda because this was a really unpopular law when the president tried to pass it. He had to cut all kinds of deals to get the votes to pass it, and then the IRS had to change the rule that the Supreme Court's going to be looking at here in a few weeks, King and Burwell. Very important, and we'll talk about that for a minute, too. But when you said that you send out weekly data, that's accurate. Every week you put that out, it's accurate. But today you can't tell us what's accurate or not.
No, I think I didn't speak properly. What I said was that in my opening statement, whenever there was a reference to information or to data, that it was cited.
Well, if you were the president, you'd want to make your program look good. And so by saying that you have the lowest number of uninsured in 5 decades, that's obviously an attempt to say, hey, this thing's working. But when we ask you those numbers, you can't give them to us. So is this just propaganda? Is this the president trying to make his bill or his law look better than it is?
What I tried to say, and perhaps I didn't say it as clearly as I should, is that any data or information that I share with this committee has to be spot on. I believe that one of the other members of the committee.
Okay, are the weekly reports spot on?
They are.
Okay, gosh, there just seems to be a disconnect here, because every week you can give spot-on data, but today in our committee you can't tell any of us spot-on data.
I think I gave some spot-on data, sir.
It would be squeezed in between a lot of non-answers. I asked you earlier, how do you get the money back from the illegals who have gotten, or the people you can't verify should be getting health care? And I don't think you had time to answer. Mr. Jordan brought it up as well. How do we get the money back that was given, subsidies that were given to people illegally?
What I tried to describe, sir, was the process that we use that's very specific to verify people's eligibility.
How do we get the money back?
And the specific talk, specific your point about getting money back would relate to how much money's been inappropriately spent. And I don't know the answer to either one of those two. I don't have the facts behind that.
Yeah. And you told Mr. Jordan that you didn't talk to anybody about the impact that the President's executive action may have?
Correct.
Okay, it sounds like something we might want to be concerned about, because it sounds like we're talking with a lot of money. And you said Secretary Burwell handled the issue of what's going to happen or not.
Yes.
In Secretary Burwell.
Yeah.
Okay, so you don't have an opinion on that? These 11 million people that you're here today saying that this law has been a success because you're helping cover, you don't have an answer for them if the Supreme Court strikes down the subsidies from the employees?
The Secretary has spoken for us.
And what she said is that they don't have a plan. They don't need a plan. Do you all know something we don't know about the Supreme Court decision?
The Secretary has spoken for us. I don't have a comment on that issue,
Are
sir.
you comfortable with her answer? I mean, you got to be able to think for yourself. Does that make you feel a little bit nervous about what might happen if it's not ruled in your favor?
I'm very comfortable with the Secretary's answer.
All right, thank you for your time.
Thank you.
Gentleman from Ohio is recognized for 1 minute.
I think, Chairman, just real quickly, I want to follow up where the gentleman from Tennessee was. So you said you have this elaborate fail-safe process that no illegals are going to sign up for the Affordable Care Act. Yet, you got 50,000 folks who've already filed their tax returns and with false information that you all gave to them. Can you assure this committee and more importantly the American people that no illegals have signed up for Obamacare and received any kind of subsidy or any kind of benefit?
What I described.
No, that's a real simple question. Can you assure this committee and more importantly the American people that no illegals have signed up and received benefits from Obamacare?
What I've tried to do is to describe the process we do to validate
That's not the question. You did that with my line of questioning the last time. I'm asking you, can you assure us that no one has received benefits who's an illegal?
Sir, we have an elaborate validation process. And I'm confident in
We've
the
been
process.
We've been here now an hour and a half, and we would like one time for you to give us just a yes or no when we ask the question. Mr. Meadows has tried for 15 minutes to get you to answer a question. We would like you to answer just this one question, because it's an important debate that's taking place in Congress this week, important debate the American people care pretty deeply about. Can you assure this committee and the American people that no illegal has received benefits under the Affordable Care Act?
Sir, I'm going to repeat.
Okay, so here's the point, Mr.
We have a
Moynihan.
very-
If your fail-safe, wonderful approach to make sure this doesn't happen, if it's so good, that would be easy for you to say, yes, I can assure you. But my guess is you won't say yes because obviously your approach on sending out tax information to these folks is not fail-safe. You got 50,000 people already filed, 800,000 people who got the false information. So it's a logical question for the American people to ask. Now, if that happened, might some illegals be getting benefits under the Affordable Care Act today? And you should be able to assure the American citizens that that's not happening, and you won't do it.
What I can assure the American people is the same assurance I give you and the rest of the committee, which is the discipline of the process for validating eligibility.
This is amazing, Mr. Chairman. This is amazing.
Thank you, Mr. Jordan. The chair recognizes the gentleman from Florida.
Good afternoon, sir. The President's program, executive program that is subject to much controversy, where he's going to issue up to 5 million work permits to people who are in the country illegally, Social Security numbers. When they get those documents, would they then be eligible to have Obamacare subsidies?
Sir, I need to educate myself better in that, the details of that.
And are you aware if a business, if faced with who otherwise is subject to the Obamacare system, has a choice to hire either a U.S. citizen or somebody with one of these work permits, isn't it the case that the U.S. citizen would be subject to the employer mandate? In other words, the employer would have to provide the Obamacare prescribed insurance, but somebody who's here illegally, the employer would actually not have to provide it. Therefore, the person who's here illegally can be hired at a lower price.
Well, sir, and I'm not a labor lawyer, and I'm not an expert in this, but
is it so with the employer mandate, though, if somebody has a work permit and they're not here legally, the employer, it's as if that doesn't apply to them, right?
I think there's some consequences for hiring illegal aliens if I'm an employer.
Well, the President's issuing work permits. I'm saying if he issues the work permits, then that's basically a signal to the employer that you can hire these people. Otherwise, why would you issue the work permits?
You know, sir, with deep respect, this is the Department of Labor issue. This is beyond my ballywork.
It's an Obamacare issue, because the reason why you would have a hiring incentive, perhaps, is because of the disparate treatment that folks will get the way the law is written. And so I just think it's important for the American people to know if these work permits enable people to go and get subsidies, then taxpayers would want to know that. If they are actually exempt from the employer mandate, then that seems to me to provide an incentive for employers to hire folks who have those, who are not legally in the country but have the work permit. And it's not, yeah, I mean, they're hiring, but it's an issue that is germane to the Patient Protection and Affordable Care Act and its requirements.
Sir, I understand the question. It calls for speculation. I don't
Why
feel
would it call for speculation? The law's been on the books since 2010. Wouldn't we know?
My understanding of your question is you're asking me to speculate if there's some type of incentive in place for an employer to hire a certain type of workforce. That's my understanding of your question.
So you look at the law on the books, you know that these work permits are coming down the pike, so it's a simple question of if somebody's illegally here and they get a work permit, what is the interaction with that and the Affordable Care Act? So it's not a speculation, it's looking at the law on the books and then explaining what the department's position would be.
Sir, I need to think through your question.
So can you reply to us in writing and we can lay out the question? Because I just think it's important to know some of this stuff, it seems it's frustrated a lot of the American people. It's kind of done on the fly and we don't even know the rules. This one we need to know one way or another. And with that, I'm going to yield the remainder of my time to my friend from North Carolina, Mr. Meadows.
The gentleman from North Carolina is recognized.
I thank the gentleman from Florida. So let me ask the last question, since you know we would not have had this hearing if you had responded to any of the 23 emails. Do you realize that? That if you just responded to my simple request, that this wouldn't have had to happen? So let me ask this question. How many people were put in a plan other than the exact plan that they had in 2014?
I don't know the answer to that yet. I know that that is a critical question, and that's information that we will be getting.
So it is your testimony here today that you do not know the number. Be careful because you're under oath. You do not know the number of people that were put in a plan other than the one they were in 2014, after 70 days of me asking.
Sir, I do not have a number I would share with you. I don't have a verified number that I'm confident
Do you have,
to share with you.
well, give me the non-verified. We'll put a big qualifier around it. How many?
Sir, with the deepest respect, I'm not going to share a number with you that's not verified.
Oh, so you have done analysis.
We are doing analysis.
Would you say there are over 800,000 of them?
I think the number is significantly smaller than that.
So you have a ballpark.
I have a ballpark. I'm not sharing a ballpark until it's verified, sir.
All right, so you put between 500,000 and 800,000 people in a plan other than the one they'd had, so they may not have the same doctor?
The issue about provider networks, and you and I have had actually discussion about this, is actually independent of,
It is.
of that transfer.
Yeah. So who decides who's in that? You or the or the insurance companies?
And you and I have discussed this as well.
And I know the answer, so go ahead and answer it for the American people.
Okay, because I come from that world. That's a relationship, a contractual relationship, as you know, that's created between the insurance company and the providers.
All right, and that's exactly where I wanted to go. So the insurance company and the patient are the ones that have the contractual obligation.
You mean the insurance company and the provider?
In the provider.
Yeah.
Right. And so as we've done that, you have reached in and you've decided for over 500,000 people what plan they should have. Did you not do that?
Sir, in the first place, that number that you threw out is not a number that I would necessarily support. You said 500,000 people. That's one.
So you say it's less than that?
As I said, I believe that it is less than that, but
Well, you have people behind you. If they're not going to help you with it, don't bring them. They know the number. You know the number.
Sir, you and I have discussed this. I am
All right.
working
Can
on
we
that
get
number.
that answer within the next 7 days?
Sir, I will get that answer to you as quickly as I can.
Mr. Chairman, I would yield back, but before yielding back, I would suggest the committee strongly look at subpoenaing all the data, all the correspondence, because it is obvious that this gentleman is stonewalling the committee, and more importantly, it's not the committee, it's the American people. And I take that very seriously, and I thank the patience of the chair.
Thank you, Mr. Meadows. I'd like to yield myself just a minute or two and finalize a couple questions here, and then we'll close the hearing for the day. The Navigators program was funded through federal grants to outreach groups so that they could enroll individuals in their exchanges. Our review has uncovered that this program in 2014 had a negligible effect. Question is this: Mr. Callahan, was the Navigators program in operation for this last enrollment period?
Yes.
How much funding was given to these support groups?
I need to confirm that with you. I'm not exactly sure. I have that information, but I can't remember it right offhand.
Where do you have the information?
In my office.
In your office, you didn't bring the information with you?
Not for that specific question.
Okay. Did you conduct any analysis on whether the Navigator program was actually improving the quality of applications submitted? That is, they had fewer mistakes?
We've done a lot of analysis about the Navigator and a sister program.
When did you feel like you had a need to do that?
I'm sorry, why did we feel? Well, to be quite frank with you, sir, it's because it involves taxpayer money. We want to be appropriate stewards of taxpayer money. It's all of our money, and we want to make sure we're getting the proper return.
You want to be properly stewards of taxpayers' money, but 52% of them have trouble as far as what are paying back $530, I believe was the exact number?
I'm unfamiliar with that quote. I know you referred H&R Block or something like that. I don't know about that.
I wouldn't think you would. You know, I'll just be frank with you. I'm fairly new at the process here. I've sat through a few hearings, but I would venture to guess if we were to ask you all these questions or all the answers to all the questions we asked that you did not know, if we were to extend a week to you, is that something that you would be willing to do to bring back the answers to multiple questions that there was basically I can't recall?
Sir, I'm responsible for the program. It's my responsibility to be accountable to the department as well as to you for information that you need.
So that was my final question, and I still didn't get yes or no. Is that if you were extended a week, would you be able to come back with most of this information?
Yes.
Thank you.
Will the gentleman yield for one point of clarification?
Recognize North Carolina.
Can you put up on the screen, you mentioned that automatic re-enrollment ended on December 16th. That highlighted comes from your website, and I know that you can't read that from there. Is there any way to blow that up? All right, but your website actually says that auto re-enrollment started on December 16th and closed on December 18th. So well, I just pulled that off because all I have to go by is what you put on the web.
I understand.
And so what you're saying is it's vetted incorrectly on your website.
No, I'm not saying that. What I'm saying is I can't see that document, to be frank with you.
Well, you can have them pull it up because it's on healthcare.gov right now, and it says that auto re-enrollment stopped on December 18th.
Oh, that's because of processing time. That's the difference between the actual start, the stop date of the 16th and the processing time to the 18th, the completion of processing.
Thank you for that clarification.
Yeah.
Thank you, Mr. Meadows. The closing remark would be one of the things that I believe that could help what I would feel like is a very poor performance is a very prompt response to many of these questions, and I hope that we all look forward to hearing some of these vital answers that are important to the American people. I would like to thank our witness for sitting in that seat for the last hour and 40 minutes and answering or doing your best job to answer, I hope, the many questions. If there is no further business, without objection, the committee stands adjourned.
Thank you.
Good job.
Well, thank you. Appreciate it.
are you or are you not going to provide this committee the emails as indicated in this subpoena? Yes or no?
We have never said we wouldn't cooperate.
I'm asking you yes or no.
We are going to respond to the subpoena.
No,
we are already
yes
starting
or
that process. Yes, we will do that. Just to supply the lowest learner emails, which we are going to supply. We're working very hard to get you the lowest learner emails.
I understand you've sent us a letter indicating that you've made available all the documents for purposes of this investigation. Is that right? I don't have the letter with me.
Yeah.
On Halloween night, I issued one of our now famous YouTube challenges. This is where I'll ask our viewers to videotape themselves pulling a
test.
prank on their loved ones and post it to YouTube. Well, last Halloween, we got a great response when we asked parents to pretend they ate their children's Halloween candy. That video, it has almost 34 million views now, so we decided to do it again this year. Over the past 2 days, parents have been uploading video titled, "Hey Jimmy Kimmel, I told my kid I ate all their Halloween candy again." We got a lot of responses. We get a lot of responses, and we whittled them down, and now once again, I say in advance,
Regina.
We have something fun for you tonight. On Halloween night, I issued one of our now famous YouTube challenges. This is where I'll ask our viewers to videotape themselves pulling a prank on their loved ones and post it to YouTube. Well, last Halloween, we got a great response when we asked parents to pretend they ate their children's Halloween candy. That video, it has almost 34 million views now, so we decided to do it again this year. Over the past 2 days, parents have been uploading video titled, "Hey Jimmy Kimmel, I told my kid I ate all their Halloween candy again." We got a lot of responses. We get a lot of responses, and we whittled them down, and now once again, I say in advance,